War I medicine, and what I'd like to do is kind of start from the broad brushstrokes. Yeah, I'm John Andrews, and my particular expertise about World War I and Bella Wood is medicine. So I'm a critical care medicine specialist, and this is near and dear to my heart. So, World War I and the era of World War I was a revolutionary time in medicine. A lot of things were changing. Pre-1900, the way a doctor or a nurse was trained was basically an apprenticeship. Sure, there were medical schools, a few, like Harvard, University of Chicago, University of Michigan, but there were probably 300 or 400 so-called medical schools in America that were basically apprenticeships, not what you would think of as a medical school today. Nursing was also basically an apprenticeship. There were no nursing schools in 1900. Zero. There were hospitals that trained nurses, and so nursing was going from an apprenticeship model, medicine was going from an apprenticeship model, and a great many changes were happening. The first nursing school, for example, was at the University of Minnesota in 1909. Really? So a lot of things were changing in terms of personnel and training and organization. At the same time, in the late 1800s, a variety of researchers discovered what bacteria were. During the Civil War, they had an idea that something bad was happening when people were dying from wounds, from wound infections. But the fundamentals of all of that were developed between the Civil War and World War I era. We still didn't know about viruses. Nobody understood influenza. But at least bacteria were being discovered and understood to a degree. The whole concept of wound antisepsis, cleaning out a wound, or even the idea of washing your hands before doing surgery were all new innovations during this era. And so, separate from the war, worldwide, medicine was changing dramatically and rapidly. Into this milieu, then, we drop the war. And wartime is often a period of time when a lot of medical innovation occurs, and I think that the term often would be the eccentricities of the service. In other words, the circumstances dictate that you do something, and sometimes what you do may be completely crazy, and sometimes it doesn't work, and sometimes it does. You start to sort out what crazy things work. So, for example, standard medical care pre-World War I. There were no antibacterial agents, no antibiotics. A lot of people don't know this, but corpsmen and medics and in World War I didn't run around with little bags of yellow stuff and dust sulfa on wounds. Sulfa wasn't invented until about 1930. Penicillin wasn't invented until, for practical purposes, the 1940s. So there were no antibiotics at all. Wound care, wound infection care had to be done without antibacterials, antibiotics. Transfusions were a very brand new and radical form of human-to-human transplantation. Think of transfusions as transplants. And they were very rare. They were hard to do. They were not easy. But at about 1910, a guy named Landsteiner had developed what we now know as the ABO blood typing system. The negative and positive, the RH system, wasn't invented until the late 20s or early 30s, but prior to that, transfusions were extremely risky. So when you think about corpsmen running out and putting a bottle of blood on somebody or putting up a bottle of plasma, these things did not exist then. In fact, IV care was a radical innovation. The idea of putting a cannula into a vein and running fluids was new and was not very practical at that time. So in World War I, as the French, the Germans, and the Brits began dealing with war wounds and war problems, a number of early innovations came in. One was the concept of triage, another was the concept of wound debridement, and another was a series of concepts of shock treatment. So these are some of the innovations, breaking them down. When the French fertilized their fields with hundreds of years of manure and human manure, night soil they like to call it. These fields were not fertilized using ammonia-based nitrogenous compounds sprayed by farmers. These were what was in the barnyard. Everybody running around, getting into trenches, laying in foxholes was covered with this stuff, which was basically a bacterial and fungal soup. So it was really bad stuff. Wounds acquired in the field in World War I were, by their nature, all contaminated. They were all dirty wounds, as we would call them today, full of bacteria, waiting to fester and kill you. French surgeon Alexis Carrel worked very diligently on the whole concept of, well, how do we save people who have these contaminated wounds? Men early in the war were coming in and dying from wound infections. They were getting gangrene, they were getting other types of wound infections and dying. So what Carrel and others developed was a thing called debridement, which was a new innovation in surgery that was enabled by the existence of anesthetics, which this is the first war in which there were anesthetics. Rudimentary by our view, but still, there were some. So Carrel and his colleagues would take a wound that might be a very small wound and open it up in the operating room under general anesthesia and thoroughly clean this wound out. They would clean out all the debris, which led to this concept of debridement, which is the removal of debris from the wound. He and another doctor, Henry Dakin, developed a method whereby after cleaning out the wound physically, they would insert a number of little red rubber catheters into the wound, into every nook and cranny of the wound, and then irrigate it with a dilute bleach solution. The bleach would kill the bacteria and was fairly non-toxic to tissues because it's very dilute. This was called the Carrel-Dakin technique, and this was a technique developed during World War I, not used now any longer, but was the basis for a lot of our wound irrigations and even the concept of wound vacs, which are commonly used now. So the idea is get the wound open, clean it out as thoroughly as you can. Another concept that came in World War I was the concept of time. You have a certain amount of time that when you get a wound, the clock is ticking. This is really the first time the doctors began to think about it this way. We think about the golden hour. We think about what happened in Vietnam with dust-offs, how quickly you wanted to get a wounded trooper into a hospital. But the start of this really began in World War I. They realized that time was of the essence. And so with wound care, with infections, they knew the quicker they got you to the operating room, the quicker you cleaned out the wound, the more likely this guy was going to live. So the concept of the golden hour that we talk about now really began then, but you couldn't do it in an hour. The whole process of triage, of setting up a triage station. Okay. So about 4 minutes to the bathroom break, that's a good schedule for me. So a lot of new concepts came in World War I. The problem was applying them. The problem was how to do it. This is also the first war where we had mechanized transport, but ambulance transport in World War I was difficult. It was uncomfortable, it was painful, it was slow, and it was unreliable. But it was better than horse-drawn wagons in a lot of cases. So a number of innovations and inventions were occurring during World War I, but one of the biggest problems was actually applying this knowledge. So for example, when the 2nd Division was sent from Chaumont-en-Vexin northwest of Paris to Belleau Wood in about a 30-hour movement, the French had promised that they would provide all the hospital care, for the Americans. This was either a well-intentioned delusion or a flat-out lie, depending on who you talk to. There were 24 ambulances attached to the 2nd Division. They loaded as many medical supplies as they could and drove those ambulances. And that's when the Marines and soldiers of the 2nd Division arrived at the Belleau Wood area. That's all they had, the medical supplies that they could stuff into 24 ambulances. They then split those between the 3rd and the 4th Brigades. So the 4th Brigade had a dozen ambulances. That's not enough for a shooting war. They had no hospitals, they had no aid stations, they had nothing. They had no hospitals to back them up. And so as the Marines move into this area, as the Marines and soldiers move into the Belleau Wood area, they had essentially no medical backup at all. Nobody had their backs. And an American AEF that was not set up to provide the care that they needed, and French promises of care that turned out to be false. And the French weren't all bad guys in this. The problem they had is that all their medical assets in that sector had been captured by the Germans. In the 2 weeks leading up to June 1st, Germany captured 45,000 French medical beds. Doctors, hospitals, that's one nurse for every 10 patients, one doctor for every 10 patients. All of the supplies, all the anesthetics, all the radiology, everything. And so the French were in a pickle. They could not provide medical care for their own people. They'd made false promises or hopeful promises to Americans. And the Americans arrived without a single hospital, with inadequate everything. And the medical side of this battle was really as desperate as the military side of this battle.